What comes to mind when you hear mental health? Although not an illicit word, mental health issues have long been considered taboo. The lack of resources allocated to mental health treatment makes clear the discomfort of societies across the world in acknowledging mental health diseases that too often end in suicide. Large-scale initiatives in suicide prevention have recently come to the fore. The World Health Organization Mental Health Action Plan for 2013 to 2020 identifies suicide prevention as a key objective. Notably, suicide rates vary across countries, with 75% of deaths occurring in low and middle income countries. Numerous data from the last decade suggest worse economic status, diminished wealth, and unemployment are economic factors associated with suicide. Our purpose was to investigate the relationship between suicide rate and measures of economic well-being in countries across the world using Gapminder. First, we plotted income per person, or gross domestic product per capita in dollars per year, adjusted for inflation and prices, against suicide rate, or number of suicides per 100,000 people. We chose suicide rate and income per person because they are independent of country population. Overall, when examining all world countries with available data, we do not observe a negative relationship between income per person and suicide rate as expected. However, we do notice an interesting trend in Lithuania, a country with one of the world's highest suicide rates. From 1990 to 1995, we see a strong relationship between decreasing income per person and increasing suicide rate. This trend may be explained by Lithuania's tumultuous political situation in the early 1990s. In 1990, Lithuania obtained formal independence from Russia, but was subsequently occupied by a Soviet party until 1991, when it finally gained its independence, albeit in a weak economic condition. These findings led us to ask, why is income per person so closely tied to suicide rate in Lithuania? Perhaps economic hardship led to a Lithuanian healthcare spending cut, and consequently lack of affordable access to mental health treatment during the early 1990s. To test this hypothesis, we looked at the influence of total health spending as a percent of GDP on suicide rate. Unfortunately, healthcare spending data prior to 1995 were not available, so our analysis was limited from 1995 to 2005. We observe a subtle increase in total health spending from 5.37 to 5.83% GDP, with a considerable decrease in suicide rate, suggesting that increased health spending may have helped to reduce suicide rate. Indeed, from 1995 to 1997, the government increased reimbursements for modern psychotropic medications, such as antidepressants and antipsychotics, and improved the condition of inpatient care in psychiatric hospitals and residential care homes. However, we do not believe a marginal increase of 0.5% GDP in healthcare spending exclusively accounts for the rapid decline in suicide rate from 1996 to 2005 in Lithuania. We hypothesize that societal differences shape the way people deal with mental distress derived from economic hardship. To test this hypothesis, we compared unemployment rate to suicide rate in Lithuania and its neighboring country, Poland. In Lithuania, we see a positive correlation between percent of the population unemployed over the age 15, whereas Polish suicide rate is constant regardless of unemployment rate. Thus, despite similar political histories, Lithuania and Poland exhibit different trends in suicide rate in response to unemployment. To conclude, our project led us to reconsider our approach to studying the relationship between mental illness and economic well-being. Although economic well-being can be correlated with lower suicide rate, we discovered that mental illness is a complex topic that cannot be explained solely by economic factors. In fact, despite the rapid decline in suicide rate from 1996 to 2005, Lithuanian suicide rate remains among the highest in the world in 2005, indicating a cultural singularity. We believe mental health policies should address mental health as a holistic condition spanning from physical to emotional well-being. As described by the English health charity King's Fund, good mental health isn't just the absence of mental illness. It's how we cope with our lives, how we handle situations, relate to others, and make choices. It's about how we think, act, and feel. Improvement in mental health should be supported via prevention and education on the issue to ensure a long-term decreasing pattern in suicide rate. Just recently, England has launched a new healthcare initiative raising awareness through a nationwide educational campaign and via commissioning of mental health community services. Although such initiatives require significant initial public health investments, which countries often do not possess, they are critical to reducing mental issues in the long term.